My name's Dave Johnson. I'm editor of the magazine Industrial Safety and Hygiene News. I don't know, in a sense, if there really are highlights in safety and health, because no news is good news, really. No news means there's been no West Texas explosion, there's been no BP explosion. When things are going well in safety and health, things are kind of quiet, and no news is being made, and that sits pretty well with professionals. I do think one highlight that I would say I've seen, you could call it a trend maybe over the last couple of decades. When I came into the field, OSHA was very dominant, cast a very long shadow over all the professionals in the field here at American Industrial Hygiene Association, other associations. Basically, job one was OSHA compliance. Well, over the last 30 years, OSHA has quieted down quite a bit in terms of a standard-setting agency. It's been much harder for them to set standards. So this has really freed up the professional to develop other skill areas, other competencies. Probably most importantly, it has gotten professionals away from the kind of really the bad negative stereotype of being the OSHA compliance cop. And they still certainly do compliance, and compliance is still very important. But there hasn't been a lot of new standards that have had to been implemented really over the last 10, 15 years, with a couple of exceptions. So this has allowed professionals to develop so-called soft skills in addition to their technical skills, leadership skills, coaching skills, engaging employees, and it's allowed them to build the so-called business case for safety. Where before a lot of companies only did safety because OSHA said so. Well, now professionals have become much more adept and are using research and some studies, become much more adept at selling their programs on the basis of what safety and health can do for a business, for a business's brand, for a business's reputation. So I'd say that's probably the biggest highlight I've seen.